Welcome back my dear friends, and now let us deal with another small topic here, that is cubital fossa. So we are now going to discuss about the cubital fossa. Now cubital fossa is actually a triangle shaped depression right in front of the elbow joint. So you have got your elbow joint here, over here, and right in front of the elbow joint there will be a triangle shaped depression there, that is nothing but cubital fossa. Now obviously in anatomy, whenever you have like triangle, rectangle, you got to learn about the boundaries of that. Now cubital fossa being triangle shaped will be having like three boundaries. So there has to be a base and then there will be like two sides there. Now in this diagram you are able to see this one will be the lateral epicondyle here and this here will be the medial epicondyle. Join the lateral and the medial epicondyle with imaginary line. Join the lateral epicondyle and the medial epicondyle with an imaginary line, and that is actually the base of the cubital fossa. Then on the lateral side you are able to appreciate one muscle here. This one will be the brachioradialis muscle. The brachioradialis muscle, you can see the origin will be like much more higher. It's not only from the lateral epicondyle, it will be higher than the lateral epicondyle, the supracondylar part. Whatever, on the lateral side will be having this muscle, brachioradialis muscle, and on the medial side there will be a muscle, and this will be pronator teres muscle, guys. So that will be the exact boundaries of cubital fossa. I repeat again, base will be formed by imaginary line joining the lateral and medial epicondyle. Laterally you will be actually having the brachioradialis muscle, and medially there will be a pronator teres muscle, guys. So between them you will be able to find the cubital fossa. Perfect. So better we'll do one thing here. Let us write down the boundaries or draw a small diagram for the boundaries here. Boundaries of cubital fossa. This one here will be the lower end of the humerus, this will be the lateral epicondyle, and this here will be the medial epicondyle. And then on the lateral side, you try to understand here, okay, there is a muscle originating more higher here, guys, and this one will be the brachioradialis muscle here. And on the medial side, will be actually having the pronator teres muscle originating from the medial epicondyle only. So no issues regarding that one. Now join the lateral epicondyle with the medial epicondyle with an imaginary line, and that is going to form the base. So I repeat again, base is formed by just an imaginary line joining the lateral epicondyle with the medial epicondyle. On the lateral surface there will be, on the lateral side there will be a muscle, and this muscle is brachioradialis muscle. So brachioradialis muscle is the one which is going to form the lateral boundary of the cubital fossa. And then on the medial side you will be able to appreciate here the pronator teres muscle. So therefore that is the one which is going to form the medial boundary of the cubital fossa. So on the medial side, on the medial boundary of the cubital fossa, there will be pronator teres, and on the lateral side will be having brachioradialis, and then base is formed by just the imaginary line. Fine. Now this makes it easier. Now the next thing that we have to learn is, what about the floor, sir? What is forming the floor of the cubital fossa? Now I don't even have to teach you here, and you don't even have to learn here. Just try to recall, guys, what can be present here in the floor of the cubital fossa here. In the anterior compartment of the arm, we have actually learned about the BBC muscle, coracobrachialis, biceps brachii, and the brachialis muscle. And the brachialis muscle is the one which will come and get inserted onto the ulnar tuberosity here. So that is the one present in the floor of the cubital fossa. And then on the lateral side there will be one muscle here, that is nothing but supinator muscle. So on the medial side there is brachialis, and the lateral side there will be supinator muscle. So those two muscles are present in the floor of the cubital fossa, guys. So you don't have to draw a diagram for that one. You just write down number one, brachialis muscle, and number two will be the supinator muscle. So these two muscles are the one which are going to form the floor of the cubital fossa. Now once you are comfortable with the floor of the cubital fossa, then let's see what is going to form the roof of the cubital fossa. And the roof of the cubital fossa, my dear friends, look at this diagram here. First of all, you will be actually having the skin and superficial fascia over there, and we have removed that one. We have removed the skin, we have removed the superficial fascia from there. Now you are able to appreciate the vein here. You are able to appreciate that there is a vein in the superficial fascia, that will be your cephalic vein here and the basilic vein here, guys. The cephalic vein and the basilic vein. Now these two will be connected in the middle with the help of median cubital vein. Median cubital vein here. The cephalic vein and the basilic vein are connected with the help of median cubital vein. Then apart from that, what else are you able to appreciate here? I hope you are able to see one nerve over here, and there is one more nerve over here, guys. Now these two nerves are present in the superficial part and they are actually supplied to the skin, and any nerve supplied to the skin will be cutaneous, and that will be the cutaneous nerve of the forearm. So one will be the medial cutaneous nerve of the forearm and the other will be the lateral cutaneous nerve of the forearm. So one is the medial, another one is the lateral cutaneous nerve of the forearm, guys, and all these structures are actually present in the roof of the cubital fossa. The roof of the cubital fossa. Fine. So after the floor here, you can just mention there, guys, the roof of the cubital fossa. No need to write down about the skin and the superficial fascia. It is obviously understood. So what else do you have in the roof of the cubital fossa here? Number one, there will be a vein, that is cephalic vein. Number two, you will be having the basilic vein, and these two are actually connected by the median cubital vein, and then you also have got the lateral as well as the medial, cutaneous nerve of forearm. Lateral and the medial cutaneous nerve of the forearm. And the medial cutaneous nerve of the forearm is a direct branch which is coming from the medial cord of the brachial plexus. I hope you remember the mnemonic as M4U. Whereas the lateral cutaneous nerve of the forearm is a continuation of musculocutaneous nerve. So musculocutaneous nerve will continue as the lateral cutaneous nerve of the forearm. I hope you are able to recall this one. So we are done with the floor, we are done with the roof, and we are done with the boundaries. Now the last and final thing which is left out to learn about the cubital fossa is the content of that one, sir. Extremely important. Now what will be the content of cubital fossa? Number one, you will be actually having a nerve here. Which nerve is that one? Median nerve. So there will be a median nerve passing through the cubital fossa. Number two, just lateral to the median nerve, you will be able to see the brachial artery. And we have discussed in detail here, guys, brachial artery will come in the cubital fossa and divide into the radial artery and ulnar artery. So brachial artery will come in the cubital fossa, and in the cubital fossa it will be dividing into the radial artery and ulnar artery. Number three, you will be having the tendon of biceps muscle also here, that is biceps brachii tendon. And finally number four, you will be actually having the radial nerve. And try to recall, radial nerve is the one which is going to take a turn in the spiral groove and come here, and after coming in front of the lateral epicondyle, it is dividing into two branches. One is superficial branch and deep branch. Now not only the radial nerve, I want you all to remember which branch of the radial nerve will be a content of that one. Will it be a deep branch or superficial branch? So remember, radial nerve, superficial branch will be a content of cubital fossa. Superficial branch of the radial nerve will be a content of cubital fossa. Perfect. So therefore, all our medical students loves to remember this with the mnemonic as MBBS. Okay. So what will be the content of the cubital fossa here, guys? That is MBBS. That's the best mnemonic to remember for the contents of cubital fossa. So better we'll do one thing here. We'll just look in a diagram here, guys. So in this diagram, you are able to appreciate here that there is a nerve coming here, guys. This nerve here will be the median nerve. Perfect. And then just lateral to the median nerve, you are able to appreciate that it's a brachial artery dividing into the radial artery and ulnar artery. So that is your B, brachial artery. Then what is this muscle here? Biceps muscle here, biceps brachii muscle. And you are able to appreciate the tendon of biceps brachii. And then look at this nerve here, guys. This nerve here is going to take a turn and then come here, and then it is going to divide into superficial branch and deep branch. Deep branch will actually go deeper through the supinator muscle, and it is the one which is going to form the posterior interosseous nerve, PIN. But what is the branch which is actually a content of cubital fossa here? Yes, that will be the superficial branch of the radial nerve, guys. That is your S, superficial branch of the radial nerve. So it's MBBS. And not only the contents, we can even remember the arrangement of the contents also, guys, with that mnemonic. So remember, even those contents are arranged in the same order, medial towards the lateral, MBBS. Okay. So let us just write down here. Contents you can remember with the mnemonic as MBBS, but the good thing is that all the contents are arranged in the same order from medial towards the lateral side, guys. MBBS arranged from the medial towards the lateral side. So that is perfectly done about the cubital fossa. The boundaries, the floor, and then the roof as well as the contents of cubital fossa. And it is also one of the most important topic, guys. Recently in the NEET PG exam, there was a question given regarding the cubital fossa, and that too it was a cadaveric image which was given. And don't worry, we'll do a separate section of the cadaveric images also, guys. Thank you. Take care.